to be heard on the screen or on the camera. That's another way of doing that. We will bring your questions in during the discussion. Yeah, no problem at all with that. And don't forget, that this is kind of your meeting as well, and I'm keen that you feel able to participate as many ways as you can. So if you don't feel like you want to speak, please use the chat box. It's there to help you to be part of it. Happy to move on now. So the feedback from our last meeting, which was the 11th of January, which I can't believe where that month's gone. It's absolutely flew by, hasn't it, everybody? So the present situation is we recognise the importance of being able to understand what's happening in healthcare, and people have believed this was a useful and excellent way of us to do that and keeping people involved and sharing information. We're trying to really evolve this method of doing that so it's more interactive and much better and much more engaging. And I guess like everybody else, we're learning all the time about trying to do things differently in the current COVID environment, where meeting face to face is not an option at all. We need to make sure we can maintain all those things, but get the benefit of being able to hear what people are thinking and be able to share and discuss those things where we can. In many ways, some ways it's more efficient use of time, and we've seen some new people coming along who use the technology and will get involved in this way who wouldn't necessarily have been able to travel for whatever reason. But again, that's important. That we can engage with as many different people as possible. And I think we also recognise, but this isn't everybody's way of communicating. Some people prefer the face-to-face, and as soon as we can, we will start and introduce some face-to-face discussions. The reality of that's going to be much later in the year. Really, I wouldn't even suspect it with this side of the summer, the way things are going and the way we need to make sure we can maintain safety at all times going forward. And keep this virus at bay. So the other comments being made is the good and relevant topics. Everyone's had a chance to be involved, and I think from the CCG's point of view, we're always keen to get feedback from yourselves and from our steering group around what type of topics you want to see on the agenda and how we can facilitate that discussion and get that out there in the open for you all to be able to participate and get the best of that. And people have said the format is evolving well, and having the agenda and the PowerPoint presentations beforehand was really useful. We didn't manage that this week. That was for purely technical reasons. They were all ready to go and stuck in an outbox, but the system wouldn't let them be released. So that was, and I apologise for that up front today. It wasn't intentionally. The intention was you would have had them for Friday at the latest. That's what we're aiming to do going forward. And it's good as well because you can be expected when it's all online and it's difficult, you don't really see or interact with people. Perhaps sometimes need to use a breakout session like Zoom. One of the things we're exploring, because there are different functions in Teams, and there are an option to use breakout sections, and we're just trying to see how we can manage to use that for future meetings, because we've talked before about having a part of the discussion focus just on Newcastle and part focus just on Gateshead, so we could break out into these breakout functions in order to do that in the future. So we'll keep our eyes to the ground and get to see how we can do that for future meetings. Next slide, Lindsay. So engagement update. We've talked to you before about the mental health transformation, and this is really picking up at a pace now across Newcastle and Gateshead. The focus being on community services and getting those right in both Newcastle and Gateshead. The place-based responses is required, and the focus has been based around that, working with the primary care networks, with the services around there, the third sector organisations, the local authorities and our foundation trusts to make this all happen. And I think we're going to start and see some significant changes going forward. And I think the current way of working has enabled us to think of doing things differently that we wouldn't have before. So being able to introduce different techniques and different methods of delivering some of the clinical service that we were a bit nervous of or reluctant to in the past. We're hoping to look in more detail at this work in our next meeting. We'll invite some speakers around the mental health transformation, what's happening, and gain your feedback and get your comments and insights into that. It's been a long piece of work, and it's been an important piece of work. There has been significant changes in mental health services over the last 5 to 6 years, but we continue to make those changes, and I think our plans going forward are much more to make sure that deliveries is in the local area and in the place space, and get people services as quickly and as effectively as they possibly can, which mirrors with what we heard from the workshops we did with patients and the public way back a couple of years ago now. Next slide. And so, again, we've got this busy week with engaging with older people in partnership with Northumbria University. There's a couple of sessions planned. We've shared these with you before. And again, if you want to be involved in these, I want to register for these, please let Lindsay or Hannah know, and it'll make sure you get the details so you can join them. And particularly the first sessions, needing help from older people to ensure you get the right care at the right time when you're assessed as being frail, and make sure it is much more accessible and making it more effective. And then the second session is about frailty pathways, and ever wondered what the right skills and knowledge and qualifications are needed to work in different care settings. We'd like your help to ensure we can get these skills and knowledge qualifications set at the right level to make sure, again, we can meet your needs and the needs of your family and loved ones at the time they need those interventions from the services. Next slide. I'm passing over to Kirsty Sprudd. Kirsty is our Associate Director responsible within the Gateshead system, so looks after all our services linking into Gateshead Local Authority, the Foundation Trust and other third sector organisations in Gateshead. So Kirsty, I'll just hand over to yourself. I understand you're going to give us a verbal update today.
Yeah, is that in relation to the COVID, Chris?
It can be whatever you need it to be, Kirsty, from Gateshead. So COVID's absolutely fine to do that and keep people up to date with what's happening with COVID. Great.
Okay, just a COVID update for everyone today. In the previous 7 days, there's been 363 COVID positives in Gateshead. That's one up on the previous week. But I think, overall, over the past 30 days, there has been a decline. So the numbers are coming down. It's just that we're kind of wavering around that 360 odd mark. The average age of the positives stands at 44, and there's been little change there over this third wave. It's tended to be the majority of people in their kind of low to mid 40s. Again, the number of hospitalisations we're seeing in Gateshead is starting to come down. It was 68 as of Friday last week, but across the previous 7 days, there's been slight fluctuations, but it's mainly been staying in the high 60s, low 70s, but certainly a major improvement on the kinds of numbers that we're seeing, certainly in early January. Just an update on the vaccination programme. By the end of this week, we'll have delivered approximately 45,000 vaccinations across Gateshead. 9,000 of those will have been delivered by the QE Hospital. They've been the main site in Gateshead for delivering vaccinations to health and social care staff. As you can imagine, getting all of the health and social care staff vaccinated has been no easy feat by any stretch of the imagination. But certainly we feel that we've made contact with the vast majority, and as and when there may be other people kind of popping up that we have missed, there's arrangements being made to get them vaccinated. So we're quite confident that we've got those covered. The remaining 36,000 or so have been delivered by our primary care networks. They've done an absolutely fabulous job. Lots of compliments based on people's experiences when they've been going to the vaccination sites. And we're on track to hit the government target of the 15th of February to have cohorts 1 to 4 completed. And that includes our most vulnerable in Gateshead and our housebound. What we're hoping is in the next week or so is that we'll start to get the go ahead to drop down to the next cohorts, which will include the over 60s and importantly the carer population. GPs have been fully briefed on the eligibility of carers and what they might have to do to reach out to unpaid carers. So there is some preparation already underway. But hopefully, if we do get word, we should be in a position really to start vaccinating those cohorts, you know, from our date in March, which is really positive. And that's it from Gateshead, really. I think based on what Chris has just said, I'll probably be back at one of the next meetings to do an update on mental health. But if anyone has any questions about anything COVID related or the vaccination programme, I'm happy to try and answer them. No. Okay then, Chris, that's everything from me.
Kirsty, I don't know if Chris is frozen. He looks like he might be doing. So I think there's a couple of questions in the chat box. I don't know if it might be worth picking them up while we wait. Judy's asked, what about the second dose? That's a good question.
I wasn't frozen. I was speaking with the microphone. Sorry.
We couldn't see you. Sorry, Chris.
No, sorry, it's okay. Yeah, the second dose, we're starting the rollout of those now. That after 12 weeks, a number of people have already got the second dose appointments. They'll be doing them over the next, well, starting in March. I think the first ones are, but they've certainly got appointments in place now.
Sorry, are there any others? I can't see the chat. Sorry.
No, that's all in the
chat. No more questions. Okay, thank you.
Same in Newcastle too. Same timeline for the second dose. We're retaining the 12 weeks. As I said, we certainly know people have now got the appointments. When we're doing the first dose, people often have already got the second appointment for the second dose. So it's well organised and well structured. Next slide. I think it'd be Jane.
Shall I just launch in, Chris?
Jane, are you there?
Yeah, just start. Yeah.
Yes.
Yeah, great. So I'm Jane Hudspith. I'm a portfolio manager in Newcastle CCG, based in the Newcastle place. So I'm glad that Kirsty's gone first, because a lot of the things that Kirsty said, I can say, oh, and it's the same for us. It's the same for us. Julian might have more accurate numbers than me. I haven't so much got numbers other than to say that they are thankfully reducing in Newcastle. I think as a system we're coping quite well compared to others. And Newcastle hospitals have sort of been able to offer some support to other areas, particularly Cumbria and Birmingham. I think obviously all of our system is under the normal winter pressures would be under anyway. And obviously COVID has sort of adhered to that. So we're doing a lot of work around discharges and trying to get people, you know, as many people going in, as many people as they can go out in a safe way. Primary care is also struggling with their normal workload, but also trying to deliver a lot of the vaccine programme as well. I was just going to touch on the vaccine programme as we go through. So as it says on there, the locations that we're currently running out of, so in Newcastle we've done it slightly differently, where all of our practices who work within all the PCNs decided that we'd run it from 2 areas, which is Newcastle Racecourse and Newcastle Eagles. What obviously we were conscious of though in Newcastle is the transport for that. You know, if people live over in the east of the city, would it be difficult to get across? So we've been very lucky to be able to get some free transport for people out in the wider areas of the city to get to those priority sites. And we've also managed to do a bit of a deal with a couple of the taxi ranks, taxi services, to get some good deals on taxi fares as well if people have been struggling to get across. But obviously we also in the middle of Newcastle have the Centre for Life, which is the regional centre. So we've also been able to direct people there if needs be. A bit like Kirsty said, we've all been working really hard on the priority areas, the 1 to 4. We've had a very robust programme working into our care homes. We actually managed to do with the majority of our care homes for those eligible patients who could have the vaccine at that visit in about a 3-day period. So it was a really big push. And to be fair to the care home providers, that worked absolutely fabulously with the vaccination teams. You know, normally we would try and avoid their breakfasts and things like that. But as a system, working with the providers, it's worked really well. So we got all of those done. We will still have the odd resident who possibly was in hospital and things like that we need to pick up on, but we've got a programme in place to do that. Linking in when people are asking about the second vaccine, obviously, again, as Chris said, we'll be looking at that for 11 to 12 weeks. I think the problem we're going to have there is if someone's had it in a different setting, so if they've had it in, if they lived at home and they're a resident by the time the second one comes on board, we will need to make sure we tie in those, but we're looking at how we do that very safely and very effectively. Just adds that little bit of extra challenge if we haven't sort of got enough. Just wanted to touch on our housebound programme as well. We've done about 17 of our over 70 housebound programme. So that's been a work in collaboration with our district nursing team and our practices to deliver those. A bit like Kirsty said, we've done a real big push on the health and social care staff. So we've done about 8,000 to 9,000 of those. So hopefully we've got a few left to get, but we're just mopping those up at the moment. And then obviously the rest of our cohort, over 70s and our clinically vulnerable, they've been running out of that racecourse site and Eagle site where we've been delivering on some days over 2,000 vaccinations in a day. So it's been a really, I've done one of the sessions and it's almost like a military operation. You go in and you get through and get vaccinated. So it all seems to be going really positively. I think for me, the real strength of it's been a real collaborative. Even like the staff who are working at the racecourse, not just practice staff, we've had library staff who've been furloughed, we've had volunteer teachers come in, we've had, you name it, it's been a whole collaborative approach. It seems to be going really well. As Chris mentioned, we've got, like Gates we've got quite a robust system set in place where we're starting to plan those vaccination programmes now for the second vaccination. But I must admit, it does feel like we've still got a long journey to go, I think, but we're working our way through. I think there's been some questions coming up on the chat, has there? Is there anything you want me to?
I've answered some of those as we've gone along. One question was around the gap, the AstraZeneca. What's the difference in the Pfizer gap and things? It's exactly the same, and they're both being tested and it seems to be effective if we wait the 12 weeks. Originally, remember that it was a 3-week window that we're looking at, but it seems to be more effective to vaccinate more population with the first dose and delay the second dose slightly to get as many people as we could on that programme. And in terms of residential care home staff, they've all now been offered that vaccine. Some haven't had it for various reasons, legitimate reasons, but we know we need to do some follow-ups and mop-ups, and we've got those in place, so they will all be vaccinated, no problem at all. The numbers of staff, I cannot give you the numbers, exactly the numbers, I can just give ballpark figures. And as Jane said in Gateshead, it was in Newcastle about 9,000, and so in Newcastle again it's a similar number. We're really motoring on through all of these care homes. And the care home residents now in both places have all had the vaccine, as have a number of housebound.
Yeah, I think one thing to say as well, Chris, is that I think that one of the challenges we've all had right the way through COVID is the way things change. So I think right at the very start, there was some guidance that was saying to staff, if you've had a positive test, don't have it for 28 days. And then, of course, there was that if you've got an allergy, don't have the Pfizer vaccine. So what we're trying to do for people who haven't had it or are a bit nervous is do some of that targeted work around the comms. And obviously, if you've got any clinical issues, we're direct to a GP. But there is, things are changing daily about the advice we're given. So we're trying to do targeted work with staff to get those numbers.
Yeah. Any other questions? Okay. Just waiting for Dominic to join us. I know he's on.
I'm here.
Oh, you're here. Hiya, Dominic.
Hi.
Welcome. You're right on time. Well done.
Thanks. Right, so good afternoon, everybody. You'll recall at our November meeting, I presented a few slides showing our current state of play, and I'm going to do something similar today. and I've got some information that is accurate as of 4 days ago, so as accurate as we can get it, just to really paint the picture of where we are, both in our hospitals, but also in primary care and the other services that we commission that will clearly impact on us all in the current period. So as people know, we're in our third wave of COVID, the second wave having been through the autumn, and not unpredictably, one could say, a couple of weeks after Christmas, we've had another peak. The good news is that the number of cases being diagnosed is going down, but clearly that takes a while to filter through to the hospitals. So for a couple of reasons, it's normally 2 to 3 weeks after infection that people get the sort of deterioration in their health that might indicate they need hospital care and support, but also our hospitals, particularly in Newcastle Gateshead, have been in a more favourable position than some of the other hospitals in the region, but also some of the other hospitals nationally. I'll say a little bit about that as we move forward. So this is the first slide, quite a detailed slide. I understand that if you press Control on your keyboard and shift the wheel on your mouse, you can expand it to make it look a bit bigger. If people find that helpful, they can do that on their own computers. But I'll just sort of orientate you a little bit as to what's on this slide. So in the far left hand corner, that sort of indicates the number of beds being reported as open, whether they're occupied or not in each of the trusts. And there's clearly a big difference between Newcastle and Gateshead in that they're very different sized organisations. And then it tells us the number of beds that are being occupied by confirmed COVID-19 cases. So in Newcastle, as of 4 days ago, it was 156 cases out of 1,367 potential sort of beds. So that gives you a feel for the scale of it. The other sort of perhaps important thing to look at is at the other end of the slide, it talks about staff absences. So the staff absences have gone down a little bit compared to the last peak, and maybe that's some indication that the vaccination programme for staff is starting to have some impact, but that's a little bit speculative. It's clear that whilst there's a lot of COVID around in the community, people that work in the NHS will also be being told that they have to self-isolate if they have a positive member of their family or household. And so this does impact on how we do our work, though there doesn't appear to be significant amounts of staff to staff or patient to staff transmission. I think our infection prevention and control provision is very robust, and certainly we've not had significant amounts of that level of transfer recently. The graphs in the middle of the slide sort of indicate the sort of peaks that we're talking about in terms of the first wave of COVID being back in April time, and then a slightly slower rise in the autumn, and then perhaps a steeper rise in the sort of post Christmas peak. And in terms of admissions, whilst there's some early indications that that's starting to come down, we're still very much in the thick of it. So we could just move on to the Gateshead slide, which is shows a very, very similar pattern, but as indicated, it's a much smaller hospital trust, so the number of beds being reported there are lower, quite a similar sort of staff absence, and a very similar sort of shape to the peaks in terms of COVID admissions. And then there are some sort of key messages, I suppose, to sort of deliver. What do these graphs, what do these numbers actually mean in terms of what we, as people who use these services, might be experiencing? So if we just go on to the next slide, I'll just take you through some of those messages. So as I sort of indicated, and as people will have read in the newspapers or heard on the news, Newcastle Hospitals particularly is providing what we are calling technically mutual aid to other sort of areas of the country. Newcastle is part of a group of hospitals called the Shelford Group, which represents those large academic teaching hospitals associated with universities who have a number of tertiary services. So bigger than your standard district generals, and some of that group in the Shelford Group are under much more strain than Newcastle hospitals have been. And so initially I think the news was that we were having to take people from London, and indeed Newcastle hospitals has taken some patients from London, but they've taken perhaps a more significant number from Birmingham and also Cumbria. Now, I went to visit Newcastle hospitals last Thursday to see the unbelievable work that they're doing. They've reconfigured some of their wards. In particular, I was on Ward 49, which they have redesigned into an ITU facility, so an intensive care ward, if you like, but they've redesigned it very cleverly with airlocks between the bays and the individual cubicles, meaning that there's much more flexibility in terms of how they work and care for patients and protect staff at the same time. So hugely impressive work that took place over the summer in a relatively short period of time that's now enabling them to expand their intensive care work. And I saw some obviously quite poorly patients who are being very adequately supported and cared for by the staff at Newcastle hospitals. Clearly, when there's this much work going on to look after very poorly patients who have got COVID, there's other work that we can't do at quite the same level. But as in previous waves, we're prioritising any emergency work, including urgent surgery, and any cancer work. So that's to do with both cancer diagnostics, but also cancer treatments, particularly when that involves surgery. So that is still going on. And, very helpfully, all of the hospital trusts in the region are working together to maximise provision, particularly in terms of that planned surgery, particularly for cancer patients. So there's no sort of spare capacity that isn't being used. And we are also, as a point further down mentions, we're also fully utilising now the independent private hospitals to work through all that urgent work and cancer work. So routine surgery, we are having to sort of postpone some of that work if it's less urgent or not to do with cancer, though we are sort of looking at maximising use and perhaps increasing use of daycare surgery and things that will be less dependent on that support from ITU, which is clearly being used up mostly by caring for COVID patients at the moment. And inevitably, this is going to mean longer waits for some procedures than we have previously been used to in recent years. And clearly, there is a cost to the system in terms of how quickly certain things can be done. But all hospitals are very sighted on who is on their waiting list, how long those people have been waiting, and are in regular contact with people on those waiting lists to see how they are, to check that their condition hasn't deteriorated, and in discussion with GPs, reprioritising if things are changing and deteriorating. And I guess that this is probably the best we can do in the situation that we're in. But clearly, hopefully, when things get less pressured in terms of caring for COVID, there will be, slowly increasing capacity. But we've got to, I guess, all be realistic about how long it's going to take to work through backlogs and what the staffing implications are going to be to try and recover some of that work that has been waiting for a very long time. So if we could just move on to the next slide, I can see there's a question coming. Right, not for me. Okay, so these are some sort of more specific things that are worth mentioning. So, as we've said before, both hospitals and general practices are making it as safe as it possibly can be for patients to come forward should they need face-to-face visits or need to attend for blood tests and things. So again, I would encourage everybody that if it's necessary for you to go to hospital to see somebody, if it's necessary for you to go to the GPs for a test or investigation, please feel confident that the staff teams there will do it in a way that will not put you at any additional risk. They'll be wearing the right protective clothing, they'll be wearing masks, they'll be wearing visors, and they'll be expecting you to wear masks as well. But certainly in my own practice, I am now seeing patients face to face every week, and not just people that need physical examinations. There are some patients with mental health problems who find it additionally reassuring to see somebody face to face rather than having a telephone call. And when that is very much the issue, I'm bringing the patient down to see me in the surgery, and all surgeries are operating on that principle. You'll remember perhaps from when I spoke to you last that we were concerned that cancer referrals were lower than we were expecting them to be, and we were worried that people were staying away from their doctors with worrying symptoms. So I'm pleased to report that cancer referrals now are almost back to those pre-COVID levels. So we're less worried now that people are sort of staying away and sitting on things that might represent serious illness. And we did have some specific campaigns because head and neck cancer referrals and lung cancer referrals were particularly low. So we did have some targeted campaigns around both of those issues to encourage people to come forward. And whether it was as a result of those campaigns or whether people just feel more comfortable going to see their doctors, that has changed. And I'm sure everybody's noticed that the way that hospital appointments and GP appointments are being delivered has changed very dramatically. And so the majority of contact for outpatient type appointments or GP appointments is still happening via telephone or video. Video seems less popular than I imagined it would be, both for hospital work and general practice work, but it's still an option, and we have the technology to do that very easily. I had a video consultation for a woman who was worried about her scar, for example, her caesarean section scar on Friday, and it was really helpful to be able to see that wound on a video and to be able to offer reassurance that I wouldn't have been able to do had I not been able to see it. So, if you've got a smartphone, don't be shy. It can sometimes be really helpful to sort of agree to a video consultation, and doctors and nurses can perhaps glean quite a lot of additional information if you sort of are willing to let that happen, and we can do it literally within seconds at the click of a few buttons, and it is largely straightforward. Clearly, one of the biggest things that is stopping us seeing the same sort of volumes of patients is that we've got to keep people apart in order to protect populations. So we have to continue to do social distancing, and as you saw from those first two slides, there are still significant numbers of staff that are absent. And I didn't point out the numbers, but in Newcastle hospitals, for example, who employ about 14 to 15,000 staff members, there's nearly 1,000 members absent for COVID related reasons. So there are staffing pressures. We do have to keep people a little bit more separate than we would have otherwise done, and that is creating additional pressure. That's also having an impact on how we do our diagnoses. So, things like endoscopy, audiology, hearing tests, there's, pressure on all of those services. Though, again, people may be aware if they've got relatives or they themselves have had symptoms that we're now bringing in additional tests to try and filter out those people that are at lower risk of having problems, to try and be a little bit smarter about who we are sending for endoscopies, whether it's a colonoscopy to look at bowel problems, or an upper GI endoscopy to look at stomach type problems. There are things that we can do now, additional blood tests that will help us more accurately filter those people who really do need the telescope tests and those people that don't. there are some groups of people that have been waiting for surgery for a long time, and these are people who have significant health problems, but they don't fall into that sort of cancer or urgent category. And I think inevitably, we've got to be absolutely open about this, there are going to be frustrating and longer waits for those patients, and we're seeing some of that going up significantly, particularly for spinal surgery, and also we've seen that for ophthalmology, though there is some good news about the ophthalmology particularly, and that's that we are funding what we're calling colloquially a pop-up hospital. So that's an additional surgical facility that will be based in the West End of Newcastle. We had hoped this was going to go live in December. Regrettably, there have been some delays, but we are assured that this will go live from March. And so people that have been waiting a long time to have their cataract operations should see that they will start to be invited, and we hope to clear the backlog for that quite quickly. And I think, as mentioned earlier, in the way that we are looking at our waiting lists, each of the hospitals is working through those waiting lists and keeping in regular contact with people to make sure that situations haven't changed, and clearly if people feel their symptoms are deteriorating, a chat with the GP or the consultant secretary can help resolve that issue. Don't wait for them to call you if you think that things are deteriorating. We're keen to all help each other in terms of making sure we make the right decisions at the right time for people. So that's a little bit of an update as to where we are. Clearly, we're still in quite a pressured situation, perhaps in terms of hospital activity, still very much at peak response to COVID, which inevitably will have an impact on other less urgent work. We're very grateful for everybody's patience and understanding, but the message remains: if you feel you have an issue that you need to talk to a doctor about, please contact your GP surgery. We are open, as we have been open all the way throughout the COVID pandemic, and similarly the hospitals are also open and doing what they can, but clearly having to prioritise cancer and urgent work.
Thank you, Dominic.
So I'm very happy to take any questions. We are a little bit ahead of time, so please pop them in the chat.
There's one hand up. David,
I can't see whose hand it is.
It's David.
Hi, hi, Dominic.
Hi, David.
Just an observation, really, just to sort of back up what you were saying. I spend a lot of my time as a previous prostate cancer patient talking to newly diagnosed men. And of course, when the pandemic started, they just completely dropped off. It was a complete hiatus for probably about 5 months. Now, I used to speak to them about rate of about one a week. Now I'm speaking to them at the rate of 3 or 4 a week. And there's a sudden rush, obviously, of people who are now being diagnosed, which is a good thing, obviously, but on the other hand, a bad thing, given that they've been sitting out there doing nothing about their symptoms for quite a long time.
No, well, that's reassuring to hear people are coming forward and getting diagnoses, and thank you for the support that you're offering to people as somebody who's been through the pathway. Yeah,
I've been doing that for about 7 years now, so it's I've been through an awful lot of people in that time. About 70 a year on average I speak to.
Gosh. Well, prostate cancer now is one of the most commonest diagnosed cancers, so I'm sure there's lots of work for you to do.
Sure.
Any other questions? We're all being very quiet today.
Yeah, I had lots of questions last time. I hope that's an indication that the systems and the services are working as people would be expecting. But we're here to hear otherwise if there are issues that people are encountering. Kate, are you on mute, Kate? I can't hear your question just yet.
Yeah, I've just switched it on. Thanks, Dominic. Yeah, I've noticed, talking to a couple of my friends, that when they've been contacting the GP surgery and they might have more than one symptom or problem, what concerns me is that they say to me that the GP is saying, well, the receptionist is saying on behalf of the GP, that they can only discuss one topic on one call. Now, as a patient, I wouldn't know which one to prioritise. Let's say I had 3 symptoms that appear to be unconnected, but could be, and you're the experts, we're not. It just worries me a bit that they will only give 10-minute appointments rather than the 20 which you used to be able to ask for in the oldie days prior to COVID.
Yeah, so I don't know if that's specific to a practice or specifically as a result of COVID, but I think that general principle that in a 10-minute consultation, which is what most GPs are sort of running on, 10-minute appointments, it's very difficult to do justice to more than one issue in a 10-minute slot. So whilst it's not a hard and fast rule, I think it's designed to try and give the right amount of time for the right amount of problems. But as you say, most practices prefer to give a bit of extra time if they've got it. Say a double appointment if there are 2 or sometimes 3 problems. So I just encourage people to sort of still continue to request those double appointments if you think you've got 2 things that you need sorting, or maybe ask for sequential appointments. So 1 appointment this week, 1 appointment the next week. That just makes things a wee bit easier. And if there are specific problems with specific practices, please let your practices know, because they will act on things and hopefully see complaints as opportunities to improve things. So a conversation with the practice manager is sometimes a helpful way to get things like that sorted. But I agree, if you've got more than one problem, you probably do need that extra time in order to have justice done to the things that are presenting.
Yeah. Any other questions? I'm actually not aware of any practices are actively saying you can only have 1 appointment for 10 minutes for one issue. I think people have been asked to say they've got more than 1 issue to discuss, and a double appointment's offered. So
yeah, I think practices do give a general message. 1 problem per appointment. So I think that is a sort of general message, but I'd hope there would be that flexibility, that there would be double appointments on offer. And Judy, I think, has put in the chat that some practices are doing that.
Yeah, that's good. Anybody else got any other questions? Well, we're ahead of time, and our next speaker is not due until 3:15. So we're due to have our break really from 3 to 3:15. Can I suggest, if there's nothing more you want to bring up at the moment, have a slightly longer break than usual and have a little drink and make yourselves comfortable, ready for the session at 3:15. During the break, if you keep your cell phone camera off and the mute, that way people won't be disturbed. Speak to you again in about 15-20 minutes time.
Thanks.
Bye, everybody. It's not quite 1:15. I'll just give it a couple more minutes, folks. I think there's a few people back on the call. Hopefully you've managed to have a bit of a restful break there between the sessions. It's 1:15 now. Shall we make a start? Can I introduce Carol Smith, the North East Counselling Service, and Carol's going to talk about getting motivated for 2021. Carol, are you happy for me just to hand over to you?
Absolutely, yeah, that's
Okay.
great.
Great,
Yeah.
thanks, Carol.
Thank you so much for inviting me along to the presentation. I hope you can hear me. Just told me my internet's gone funny. So I just wanted to think about improving people's mental well-being, and the way I often work and when I'm giving presentations is I just throw some ideas out there to get people thinking about things that they can do to help themselves and improve their mental well-being. So the first thing, not sure if I can, there we go. The first thing is we're back into lockdown, and obviously that happened in January, but I don't know about everybody else, but I naively thought that on the 1st of January at 1 minute past midnight, there would be an announcement on the TV saying, oh, it was only a joke, everything's fine again. And I think people have been struggling even more this time with lockdown. And, you know, our counsellors are talking to us about their own struggles. And I think the length of time things have gone on. So what I want to say is cut yourself some slack and make sure that you're doing the things that you need to keep your energy up. And one of the things we tend to do throughout the year, especially New Year's Day, don't we? We have a whole list of resolutions, things that we're going to do. And these things can be really detrimental to our mental well-being, especially if we set loads. Like if your New Year's resolution list looks like this list here, please just reduce it and think about the things that, one, you're likely to achieve and make them more achievable, and just have a couple of them if you really must have more than one. And I think sometimes we stress ourselves out by saying, right, I'm going to lose weight, I'm going to do exercise, I'm going to do this, and this, and then we stop doing them by February. I'm going to drink less, that's okay. And so thinking of your mental well-being, think about, have I set myself some goals for this year, and just make them much easier, because this year's a tough year already. The next thing to think about, and there's a lot of work being done about people's resilience, mental resilience, and the link between that and their mindset. And it's been found that people who have a growth mindset as opposed to who have a fixed mindset fare much better in terms of resilience. So when I'm talking about a growth mindset, I'm talking about things where, you know, those messages you get in your head that always telling you, you're no good, I give up, I'm not good enough, it's those kind of things. They're the fixed mindset, or we've always done it this way, why shouldn't I always do it this way again? We need to be trying to think about, okay, where can I see the opportunities? And, you know, there have been some opportunities from this very difficult time, but we've got to look for them and try building on those and try thinking, okay, what can I do? And on one of my presentations online, if you look on our website, there's a booklet which has got a test in, which helps you think about, have you got a growth mindset or a fixed mindset? And it's certainly something to really have a think about. The next thing is there has been tons and tons of research done over the last few years about gratitude and the link to resilience. And it sounds a bit fluffy, and I have to say I was a real skeptic about this at one point. But if you take some time every day thinking about things that you're grateful of, then your mindset will change. You'll start to think of positive things first, and it'll really help you to look at things in a different way. They don't have to be massive things. They can be little small things, but start to think about your blessings and the good things that are happening in your life. And then those positive thoughts will come into your head much quicker. And I have to say I was a real skeptic about this, but I've practiced it and it really did change my mindset. I'm naturally a pessimist, and boy, did it change my mindset when I did that. So have a think about your gratitude, maybe share some time with friends in the morning. I've got a group of friends who do a gratitude Zoom meeting every morning to think about the things they're grateful for, and just talking about them and saying them out loud can really help your mindset. Thinking about this, I don't know if you're like me, but I find it very, very difficult to ask for help. I could be drowning and I still find it very difficult to ask for help. And really what we need to be doing is identifying what kind of help we need and asking people for that specifically. And if you just say, oh, I just need help, that's really not going to do you any good. What you need to be doing is thinking, what do you need help in, and making a specific request. Because sometimes people don't do things to your standards. They don't have the same viewpoint of what help is. They might be thinking, oh, well, this is help, when actually all you want is somebody to make you a cup of tea. So think about what help you need and ask for it. Be specific and ask for that kind of help. And when you're not sitting there fuming because nobody's doing anything to help you, you can really get some good support, because it's the support you need. One of the things we often do is we have these massively high expectations on ourselves, and we think that everybody's expecting something marvelous from us. And actually the pressure is coming from us. We expect to do things perfectly. If you're doing something, it's got to be just right. The house has got to be so tidy. This has got to be so right. That work has got to have no mistakes in it at all. And actually, when we look at it, we think, well, where are the pressures coming from? They're coming from us. And if you are finding that you're setting yourself massively high expectations, they'll just weigh you down. And, it's like carrying that great big heavy weight upstairs. So if you're feeling under pressure, start to try and think about where that pressure is coming from. Is it coming from somebody else? Is it coming from yourself? Is it coming from you thinking, oh, well, people will think X of me if I don't do this? And really try to find a way to let those high expectations go, because they're just draining you of your energy. And this kind of matrix I found really, really useful when I found it. And it's about, where are you on the emotional energy matrix? And when you think about it, quite often you're using high energy and it's negative energy. Sometimes we're using caffeine, we're using alcohol, we're using all sorts of things to keep us in that survival zone. If we're stressed, we're using the cortisol and the adrenaline hormones that are coursing through the body. And they take up a lot of energy, and it's all negative energy. So what happens is we spend some time in the survival zone, and then we get burnt out and drop down into that low energy zone. And then sometimes when we're in that situation, we miss out the recovery zone and try and move to the performance zone. Well, it can't work, can it? If you think about it, unless you're getting positive energy inside you, and you're building up your resilience again, and you're building up your kind of energy, how can you move from the burnout zone to the performance zone? So it's worth thinking about, okay, where am I in this energy matrix, and how can I move from the burnout zone or the survival zone over to the ones on the right hand side where they're positive. And you know what ideally we want to be doing is dipping between the performance zone and the recovery zone and backwards and forwards by putting our energy into place so that the energy that we have is positive energy. So by just thinking about where are you at this moment in time, then you can start to put some plans in place to help you build up your emotional energy. And then, you know, be kind to yourself. How many of us have got those words in our head about ourselves that we would never say to a friend who came to us for help? You know, the harsh things that we say to ourselves, that really does take you into the negative energy side of things. So if you find yourself being really negative to yourself and being really cruel to yourself, try and stop those thoughts and change them into something kinder. Think about, what would I say if it was a friend who was asking me this or a colleague who was asking me this? I wouldn't tell them they were being stupid, would I? So really take notice and be kind to yourself and do things, little things that will treat you. So that's just a whizzy tour of some of the things. I don't know if anybody's got any questions that they would like to ask or anything they'd like to comment. I've got lots of free presentations that are available online and you can access them on our website, and you know, hopefully you'll find them useful. Thank you.
Any questions, anybody? You're definitely very quiet today, folks. So I don't know what's happened.
If anybody needs anything, they can get in touch with me directly. And oh, has Kate got a hand up?
Yeah, she has. Yeah.
Oh.
Hi, Kate.
Hi. Yeah. I suppose I was just wondering, Carol, what it's like at the moment. Is the support that people are looking for pretty low level? And if they get what I describe as low level, you know, just looking at that energy, the way they use the energy that, as you've just described, which is a great way of looking at it. Is that often enough, or are you finding that people are coming to you perhaps a little bit too far down the route? You know, so they felt pretty bad in March, April, and they've not actually come to you till now, January.
Yeah, I think that there is a real mixture going on, Kate. We are getting people who are coming at the low level side of things, but sometimes people have tried out other bits of support first of all, and then by the time they come to us, it's a bit different for us because some of our services are funded for people. So we've got we work in Gateshead with people who are carers, and obviously we've got a good link with the Carers Association, and they refer people into us at an early stage. Where people don't have access, or we don't have access to funding for people, what we tend to find is they may have tried waiting for IAPT services or something like that, and now they're coming to us to get some support. But generally that's it's, you know, a paid for service. So we're finding a real mixture of people coming in, but on the whole I would say a lot of people have left it a bit too long and their energy's very depleted. It's sad, really. But again, there's the stigma, isn't there, around mental health, and you know, the cry you hear so much is, oh, things aren't that bad yet. Well, things are much easier to help you solve problems if you come at an early stage.
Yeah, absolutely. That's what I was imagining, really.
Yeah.
And I think, as you say, the whole issue is sometimes around the funding. So as you say, I can think of quite a few people who over the last year have waited for the IAPT service. And yeah, it's been a bit too long for some people.
Yeah, because generally what you need is maybe just a few sessions of being able to talk about your problems and, you know, being guided through the process just for a couple of sessions. Whereas if you're waiting, the thoughts that go on in your head get worse and worse and worse, don't they? You know, it makes life much more difficult. So
I mean, those people who've suffered a loss, you know,
yes,
the bereavement and grief side of things in particular, related to the sudden loss of someone. You know, it's been exponential this last year, hasn't it?
Yeah, absolutely. And, you know, it's not, in that case, it's not really bereavement counselling that we would be doing. It's about ensuring that that person understands that they are going to feel sad and upset and look at the guilt that they're probably feeling. Maybe they couldn't be with that person when they passed away and those kind of things. And we'd love to be able to see more people, you know, get them into the service, because it would be short-term interventions, I think.
Yeah, thank you.
No problem.
Any other questions or comments from anybody?
Paul?
Paul's put a question in the chat box and we're just going to raise it now verbally.
Right.
Paul?
Oh, hi. I was just wondering, in question to the counselling service, are you actually helping out the IAP services? I've been asked to help them out at all.
We are in discussions in Newcastle at the moment to help out the IAP service, but we do have capacity to help in the round, and the model that we've got is we can always bring more counsellors on stream if required. So we're in discussions at the moment, but we've got capacity there.
Yeah. Just does everybody know what IAPT means, just in case you don't? I mean, I'm happy to explain it. It was an initiative which started about 10 years ago now, maybe it's a bit longer, it's difficult to remember the time, which was called Increasing Access to Psychological Therapies. And it's a group of talking type therapies that people can access to help them early on when they've got a problem, usually related to depression and anxiety type symptoms. I don't know, would you say any more than that, Carol, about it? It's usually generated around counselling and those kind of activities.
I think it's been a great initiative because it's allowed people to refer themselves in for services, so they don't have to go through their GP. The sad thing is it's been so successful that people then have to wait, which is the need is huge. But it's certainly raised awareness of mental health support.
Yeah, it's certainly overwhelmed the services at the minute.
Oh, absolutely.
And as Carol says, we're in discussions to try and expand some of the contract and some of the other organisations supporting delivery of that service out there in the communities.
Mm-hmm. And the service we provide is different to the IAPT service because quite often it's a cognitive behavioural therapy approached, whereas we deliver counselling and our counsellors work in a more holistic way. So some do offer cognitive behavioural therapy, but actually, you know, they'll work with what the client brings and work in the way the client needs. So it's slightly different, but we're finding that on average people are using about 4 to 6 sessions and then they feel okay to leave the service.
Okay, any more comments, questions? Okay, thanks very much, Carol, that's been really helpful.
Thank you, thanks very much, Kirsty.
Okay,
take care. Thank you. Bye.
Bye. So nextly actually moves us on the agenda. So health and wellbeing tips, and I think we talked previously about, you know, doing things ourselves and trying to keep ourselves, our energy levels up, as Carol's talked about there. And I think Lindsay had asked people around sharing some of the things you've been doing. And here we can see Judy's Pilates at home. Judy, do you want to talk about what you've been doing?
I had no idea we were going to share that really revolting slide.
No.
I was just coming out of a position there. I'd always been, well, not always, for about 4 years I've been doing Pilates. And when people were not able to gather anymore, I was finding it a huge loss. Fortunately, my teacher started doing Pilates at home sessions where she runs the course from her studio or her kitchen, and we see it streamed and she can see us and give us feedback. And recently, knowing that we're all spending far too much time at meetings like this, she's instituted Pilates SOS sessions for lunchtimes, which focus on the neck, shoulders, and upper body that gets stressed from bad worktop positions. It's been remarkably helpful. And I just think that anybody would benefit from this. I think they'd benefit from the stretching, the breathing, and from learning really about the connections in your own body. So I'm a huge fan. Pass it on.
That's great. Thanks for sharing that, Judy. That's useful. And I see at the end of it, you've got a recipe for banana loaf.
Yeah, everyone's doing them. I finally cracked the perfect recipe, so passing it on.
Yeah, that's great. We'll share that with everybody else. Anybody else want to share anything you've been doing in terms of your own personal health and well-being to keep yourself energized and rebuilt up? Kate?
It's just me again, isn't it, today? Yeah, I've done several things, really. I mean, before, in the first lockdown, I was just doing a lot of extra walking, really. And when I was out walking, I was then doing a 2 or 3 minute run to try and just get my heart rate up and things like that. I then went on to doing Joe Wicks, and I have to say I got myself really fit. So I was very pleased with that. And I have to say, doing that first thing in the morning, I found it was a real mind boost just to have done some activity. So